The virus's impact once again putting a huge strain on already overloaded hospitals from coast to coast. NewsNation correspondent Marky Martin joining us live tonight from Dallas with a closer look at how hospitals and workers there are just now trying to keep their heads above water. Marky.
Rob, as states across the country are seeing a steep increase in COVID cases, hospitals are witnessing an unprecedented number, an influx of patients. Some of these systems at their breaking point, with some hospitals having to medi-flight patients to other regions. Some just don't have enough staff to keep up with this growing demand. And right now there is no handbook for these hospitals to turn to tell them how it's done.
Our staff is strained at many of our hospitals now. They're bending, they're elastic, they're making the changes necessary.
And so is the story of healthcare workers from coast to coast, adjusting to the record number of people they have in hospital care.
So many of us on the inside are tired. It's been a lot of long hours.
Dr. Christian Sandrock is a frontline worker treating COVID-19 patients at UC Davis in California, the second state to surpass 1 million COVID infections.
Some of our patients are relearning to breathe, walk again, regain strength. They have to regain a lot of their facilities.
In Illinois, hospitals are reaching what's deemed threshold levels. With 5,200 COVID patients statewide, rooms are filling up at an alarming rate.
We have more physical rooms than we have nurses and pharmacists and techs and respiratory therapists and doctors.
The state's top public health officials and governor pleading with residents to follow mitigation measures heading into the holidays.
If we wait to take action until our hospitals are full, it will be too late. And countless patients will die unnecessary deaths because there aren't enough beds or people to staff them.
Auxiliary hospitals like this one in Chicago, popping up in most American cities, providing care to the overflow of infection. And in Colorado,
we are approaching the kind of numbers that New York faced back in the spring.
Hospitals bursting at the seams, with 84% of total available ICU bed space having been in use the past week. Medical authorities also warning that just because we're seeing an uptick in cases does not mean we're seeing an increase in staff.
If you have like a hurricane, you can bring people from all over the country to that area to help. But everyone throughout the country is dealing with COVID-19. So good workforce are hard to find. The traveling nurses are hard to find. So we've just got to work through this, but it is a real concern.
It really is staggering. Of course, in the past week, a couple of promising updates on the vaccine front. Can also tell you just yesterday in Texas, doses of the monoclonal antibody therapy from Eli Lilly started being distributed to critical care hospitals across the state. And wanted to share this too. According to the Department of Health and Human Services, just checked it today, there are some 76,000 inpatient beds that are full of COVID-19 patients across the country. That does not include the tens of thousands who are in ICU beds right now. Reporting live in Dallas.